Welcome to our emergency department. We're here to talk about stroke and stroke care and how important our partnership with EMS is in caring for stroke patients to make sure that they get the fastest care possible to achieve the best possible outcomes in stroke. As we know, time is extremely important in stroke patients. Every minute that goes by is parts of the brain that are being affected by the lack of blood supply, and the faster we can get treatment and restore blood flow to the brain, the better the patients will do and the better their outcomes.
Early activation of the 911 system is huge. It starts the entire cascade. You don't want to fool around. If you have any of the symptoms, call 911 right away. We'd rather come there and check you out and be fine than you wait and something bad happens.
Once it's determined that the patient is meeting the criteria for the stroke signs and symptoms, we utilize an immediate transport and get to the closest appropriate facility, which would be the Good Samaritan, which is located in Brockton, which is also our affiliate hospital for the town of Easton Fire Department. Once we're en route to the hospital, we make a pre-hospital notification that the patient is exhibiting signs and symptoms of a stroke.
We talk to EMS before they arrive. They give us a notification that a stroke patient is on arrival. We call it a code stroke, so that the whole team here is ready for the EMS team to arrive. As soon as they walk in, they come through the bays here and come into this area. We'll take a quick report, do a quick assessment, and directly from the EMS stretcher, we'll go right to CAT scan, which is just about 30 feet that way, and get a quick CAT scan of the patient's brain to make sure that everything is okay, and we can start all of the stroke treatment. While we're looking at the images as they're coming up, we're also simultaneously mixing up medications to give, such as TPA, and we're also on the phone with the neurology team. They have direct access to the images, so they can be looking at the images as they're happening within 5 to 10 minutes of arrival to the emergency department, so patients can get treated very quickly.
Just wanted to thank all our EMS partners. You guys do amazing work. We pay tribute to you. We know your hours. You're putting yourself in harm's way. You're going into the unknown. You're sacrificing your Friday nights, your weekends to be here for your patients. You know, you are the lifeline between patients' first medical contact to Good Samaritan. So we can't thank you enough.